Okay, now we have some interesting developments in government at the moment. Right now, in the in the House, I believe Bernie Sanders has signed on to similar legislation in the Senate. But Representative John Conyers from Michigan, MI, Democrat, on the House Energy and Commerce, Ways and Means, Natural Resources Committees, has introduced H.R. 676, Expanded and Improved Medicare for All Act. Now, quick little summary. This is basically exactly as it sounds. See a little bit from the summary here. This bill establishes the Medicare for All program to provide all individuals residing in the United States and U.S. territories with free health care that includes all medically necessary care, such as primary care and prevention, dietary and nutritional therapies, prescription drugs, emergency care, long-term care, mental health services, dental services, and vision care. Now this is, of course, this is what progressives have been wanting for a while now. Technically, going back to the birth of Medicare to begin with. That is a whole other story again. Well, actually, yeah, I'll go ahead and talk about that too. Let's see if I can find the article for it. There's an article in Intercept that was had some good information on it about this. Okay, now, so what's going on with this bill is that Representative John Conyers introduced it, and it currently has 76 co-sponsors. Last I checked, Justice Democrats has been sort of keeping a tally and giving every so often posting a picture or a chart of the number of Democratic representatives who have yet to co-sponsor the bill. In an effort to try to motivate people to contact their representatives and encourage them to grow a fucking spine and to sign on to the bill. And see, that's the thing too, like, I feel this system does make a lot of sense. You know, essentially expanding Medicare to cover everyone. Because Medicare is a very popular program. It's also very effective. Some recent data that I come across said that Medicare is actually significantly more efficient at delivering care. Like dollar for dollar, like every dollar it brings in, more of that money goes back out to actually pay for care than for a private insurance company. Private insurance companies are required by law, it's the only reason it's that high, at the moment to spend, I believe, like 80% of their revenue on coverage or providing care, and they can keep the other 20% for profit and whatever else they want to keep it for, administrative costs. I believe with Medicare, it's something like 96% of all the money that comes in is actually spent on providing care, which is a fair bit better efficiency. You know, people always talk about, government waste and inefficiencies. We have to privatize because the government just can't run it properly. Well, evidently they're running Medicare very, very well and very efficiently, and they are effectively providing care. So, by just taking that system and expanding it, and in addition adding some other things like the ability to negotiate drug prices and various other aspects of it, you could also help bring down the cost even more. So I like the concept. I think expanding Medicare to cover everyone's a good idea. And evidently, so did LBJ and various other people in Congress. Because there's an article in The Intercept That was, when was this published? This was published yesterday by Zaid Jilani. Jilani, I believe. Anyway, a link will be in the description. That goes into sort of the background of Medicare. And as it turns out, when Medicare was first introduced, that was actually the initial plan. They were trying to cover everyone, but they couldn't get it through the Congress because, guess what? There were special interest groups and lobbyists back then who didn't want it passed. So, let me read a bit from the article on the history of Medicare in America. Okay, the reason Medicare was offered only to senior citizens is a tale of legislative compromise, not intellectual intent. Since Theodore Roosevelt ran on a platform of health insurance for all industrial workers as a presidential candidate for the Bull Moose Party in 1912. So there's one for you. Fucking Teddy Roosevelt in 1912 was pushing for a form of universal health care. Anyway, offering government-backed health insurance to workers has been a progressive cause. Franklin Roosevelt, FDR proposed guaranteeing a right to health care shortly before his death. His successor, Harry Truman, worked hard to pass a form of single-payer health insurance, but was defeated in Congress after a smear campaign, wait for it, led by the American Medical Association that associated the president's plan with the Soviet Union. That is something, too, I took issue with. This is the fucking AMA, the American Medical Association, an association made up of doctors and people in the medical world. And that's something that still gets me. The idea that this is shameful. Someone who is a doctor, who has devoted a significant chunk of their life to healing the sick, caring for the ill, and to saving people's lives, and they want to stand in the way. They make sure people can actually afford the care that we offer? No, hell no, fuck that. We don't want to be told what to do. You're supposed to be doctors. You're supposed to be helping people. All right, you're supposed to be helping your patients. This is not helping patients. This is wanting to make sure you get more money. And that was an issue I've had too. That's a little side rant. I work in the medical industry. Again, it is an industry, make no mistake. And it is just something that just makes me sick. It's just, it is a industry that basically revolves around attaching a price tag to quality of life. And coming up with a dollar amount for a person's life, to me, is disgusting. The idea that, and maybe it's just the thing, that's how I was raised, that no amount of money is worth a person's life. You don't say, okay, well, yeah, I would like to help the sick person, but we wouldn't make any money off of it, so we're not going to do it. It's sickening. That is a major taboo. That's not what you do. You help others. But anyway, going back, after that little rant thing, going back on the topic here. So the article goes on to say that basically they kept working on it until 1968. See, when did they pass Medicare? They actually don't have the date in here. But anyway, they passed Medicare. Basically, they were able to pass Medicare because Medicare was just for the elderly, which is a group that normally required more health care than younger people, and so were more expensive to cover. So the insurance industries or companies were like, okay, yeah, go ahead. Then that'll take the burden off of us. So they did that. But the plan was that, okay, now we're going to cover the elderly. I said, get it out there, get people thinking like, okay, here's how this system works, and it works well. And then to start expanding it to other age groups. For instance, let's see, Johnson covered... Johnson administration officials didn't wait long before calling for expanding health coverage. Johnson explained to Congress in his 1968 State of the Union address that he wanted a child health program to provide over the next 5 years for families unable to afford it, access to health services from prenatal care of the mother through the child's first year. Cohen was tasked by the president to design the program, which Ball refers to above as kiddie care. And then it kind of got lost in the noise from... But the problem is that program got sort of lost in the noise between the Vietnam War and various other issues going on at the time, and it never happened. And today the United States continues to have the highest infant mortality rate in the industrialized world. So, and that's something I had never really known about. I had no idea that there were actually at least a few efforts to try to pass Medicare for all in the before. In fact, that's what Medicare itself was originally meant to do. But, and I said, it's good to see this being pushed through. This HR 676, where we'll actually provide this coverage. And of course now, let's be realistic, will this actually pass? Well, let's see, we'd have to get it past a Republican-controlled House, a Republican-controlled Senate, and have Donald Tiny Hands Cheeto Trump sign it. So no, I really don't think. I don't think it's got like a snowball's chance in hell. I will say this: weirder things have happened, but I highly doubt it. So what this really is basically it's something. It's sort of moving the needle to the left. It's something, in my opinion, that could be used down the road to say. When the Republicans, gripe and complain about, oh, well, you didn't help, where was your plan to reform healthcare? It gives them something to say, yeah, here's what we proposed. Not a single damn one of you even gave it the time of day. It's something to kind of use there. And also, too, like I said, it moves the needle to the left, and it gets people talking about it. And that's something I like. That's what we need, and it's what we need to keep doing. Is, you have situations like with Bernie Sanders doing town halls. Is it something that CNN's doing for the ratings, or MSNBC's just doing for the ratings? Sure, yeah, I have no doubt. But they're still doing it. And that's good, in my opinion. It gets those issues out there on a national platform that everyone sees. All right? And it introduces them that. So then you have people going back and hearing about stuff like that. It being put right in front of their face and going back to their representatives and their congressmen and saying, hey, why aren't you supporting this? And that's good. It makes it a bigger topic. Because like I said, the idea of having a Medicare for all system has been around since universal health care or at least a form of it in the U.S. was first introduced in 1912 by Teddy Roosevelt. Here's 2017, over 100 years later, and we still don't have it. And part of the reason is that, no one pays attention to it. It's it's brought up, it doesn't go anywhere, it kind of falls out of favor. And that's something we need to do. We need to keep the pressure up and keep going on it. So, anyway.